What do you think is the largest issue as far as the technology goes today to actually accomplish what they're trying to accomplish as far as health information exchanges, both inside of the hospital organization, between the departments, and also outside of the organization to the physicians' offices?
I think it's the connectivity and the interoperability are very key. Organizations that can work with service-oriented architecture will be very well positioned so that they can actually easily make those exchanges happen for them. So I think those are some of the big challenges, is how do we take our legacy applications and make them interoperable? Are there applications and tools that we can use, kind of layer on top of them, because organizations can't afford to do a rip and replace, particularly with the clock ticking for being qualifying for the error incentives. So they can't just tear out old technology and put in new technology. In many instances, they'll use products that they can layer on top to create a unified view of the patient data across all of these disparate systems. Particularly when you look at integrated delivery systems, many of them have formed through merger and acquisition. So they're running a whole host of disparate systems. Even if they're running the same vendor application, more than likely they've implemented it differently. They're on different versions. They could be even widely different architectures depending upon the product life cycle of that particular vendor. So working to get data that's locked in these disparate systems is probably the biggest challenge, because it's very clear when you look at the writings of Dr. Blumenthal, when you look at the definition of health information exchange in the legislation itself, that active health information exchange was one of the 3 requirements for qualifying for the incentive payments. So getting at that data, interoperability, all key challenges, and particularly to do it in a fairly short time frame.
Right. Do they have any technical issues to overcome, or has that technology advanced to the point where they can actually take data from one disparate system and move it into another disparate system pretty cleanly?
Well, that's where you see tools, like the Carefx with the interoperability coming into play, and being able to move that data from these siloed applications and being able to aggregate it as a presentation view, not necessarily maybe aggregating the data model, because there's the whole notion of federated versus centralized data model, and there's some key distinctions there, but being able to bring data from multiple places in order to present a unified and organized view for clinicians.